I'm making this video on Monday the 13th of April, when people in the UK are taking in the shocking news that our coronavirus death total has now reached officially over 10,000. That's 10,000 families facing loss, unable to grieve properly, and those graphs show that the world over faces the same problem. And these are the figures that the press, statisticians and modellers are relying on. But what if I was to tell you that actually these numbers are wrong, certainly in the UK? Because the NHS's own revised figures are showing that what was actually announced each day as the daily death toll far underestimates the actual deaths that took place that day. In my personal view, it's not deliberate deception. I don't credit the government with that much of a plan. I just think it's another result of the fragmentation, of the cuts and privatisation of services and chaotic management of this crisis that we've seen with the lack of PPE and the lack of testing, and now with dubious data that we have to try and work out what we can do with. Now, this table will give you some idea of the difficulties in relying on data in the UK. The left-hand column are the daily announcements that were made by the government and their spokespeople saying how many people had died that day. But the other columns show what the NHS in England at least has revealed as the true death tolls in England on those particular days in question. So take, for example, the 18th of March, announced as 32 deaths across the whole of the UK. Now appears on the 5th of April that was 57 deaths just in England alone in their hospitals, now re-revised up to 59 on the 11th of April. Looking further down, you can see that things have got worse. On the 28th of March, announced 247 deaths in England only. The new revised figures from the NHS suggesting, in fact, 329 died in England that day. And you can see the rest of the mismatch. So we have data and we have announcements which are seriously underestimating the actual deaths that's taking place in that day once the delays are overcome and all the data is processed. Now, where does that leave myself and others who are trying to model what is going on in England and the UK? Should we just throw the maths aside and say it's not worth even trying with? Far from it, because actually maths can help make some sense of these dubious statistics. Because we have shown already in previous videos that I've made that the data does tend to lie on an exponential curve with a regular doubling as we would expect, and that if you plot that data logarithmically, you'll get a straight line graph. And that gradient of the straight line graph gives you a growth constant, which helps you show the doubling time, which actually seems to match with real data, as you can see here. So no, the maths is useful. The maths that was then extended in a later video to show that in fact we need to look at an S-curve rather than just an exponential growth where the growth starts to level off and we reach a point that everyone's looking for, the peak, the maximum daily death toll, when the graph will start to level off again. Can we find that, even though the data we've got is a little dubious? This table will give you an idea of the difficulty in making sure that you're using the right data. These columns, and they're all for the rest of this video for England only, because that's the easiest data to get hold of. All of these columns show the death tolls from various different official statistics for England. On the left-hand side, the column as announced on the day and obviously used in press reports and most internet statistics, hospital tested deaths only. The next column, the re-revised totals for the NHS England, looking back as data comes in and putting them against the actual date of death. Revised again in the third column on the 12th of April as new data came in. As you can see, sometimes those revisions go right back several weeks, so that your data is always never quite up to date. And the very last column is one where at the moment we still haven't actually got that much detail, which is future statistics which are being announced that take into account not just deaths that took place in hospitals, but also in other settings like care homes and where there wasn't an official test, but the registration has referred to COVID-19. And those deaths could be very important because, as for example, France has shown, they could make a considerable addition to those that are registered as having died in hospital. For the moment, let's use the data we've got to try to put the graphs together. Here, the announced daily updates as announced by the government, putting then those into a logarithmic graph, then we get the straight line as we have done before, with a doubling of roughly every 3 days. Then here, this includes the revised daily updates, again a similar gradient, but of course higher values because more have been added to the original amount. The re-revised daily updates, pretty similar, and also actually the deaths out of hospital, fairly similar, a very slightly different gradient. But actually, let's really going to use the blue data, the re-revised data, as being the most useful and accurate for now. These two lines are logarithmic graphs comparing the data as announced by the government and comparing the data that is now being revised by NHS England. And you can see they're similar in that both are parallel lines, the gradient is pretty much the same, the growth constant is pretty much the same at round about 0.23 and therefore a doubling time of about 3 days. But the important difference is that the revised data has got higher totals. And so at the beginning, while the announcement there said 25 deaths had taken place, the revised data suggests more like 55 takes place, roughly double, slightly more. Now that's only a small amount at that stage, but as you continue to double and double and double 5 times over 15 days, then a difference becomes magnified. The 25 becomes 800 in the announced data, but the 55 becomes more like 1760 in the actual data. So a small error can become quite magnified over time. Yet these mistakes will also be being made by those who are using these announcements to model, including medical researchers and so on. My simple model I'll show here. So here is the graph of the data using the original daily announcements, an exponential curve that fitted them to start with, but then as we've shown, a logistic S-curve which fits them better over time. Now looking at that logistic curve that matches the data that's been announced, it seems to suggest an overall death total of about 15,000. But is that likely to be accurate? No. Because the announcements are underestimates, the death total is also likely to be an underestimate. This would suggest that we've already passed the peak, but we haven't. So the maths is also backing up the fact that these data are not accurate. Let's try instead using the revised NHS England data. And as you can see to start with, you get a similar increase, if anything on a slightly slower rate of growth, but obviously at a higher number of totals altogether. And so the line starts at a higher point than the green data for the actual announcements that have been made. How does that develop over time? Again, here's a possible exponential growth for the beginning, but over time, of course, we need a shallower graph as we start to flatten the curve. And instead, let's have a look at some possible logistic S-curves that might fit that blue data that's been announced by NHS England. Now you can see that actually the track for 15,000 deaths seems to fit the data reasonably well. But other international modelers using far more statistical analyses than I can are suggesting that actually the death total in England might be more like 30,000. So perhaps it's that top curve that we need to be looking at. Now, there are different interpretations that's possible. It could just be that we still haven't got the finally revised data. that the data totals are still lagging behind, and when we actually get the new data, it will be on that logistic curve, that steeper curve, tracking towards perhaps a final death total of 30,000, rather than the line of best fit that fits them at the moment. Time will tell. Now, a death total of 30,000 is hardly good news, but there is one silver lining to that, which is if that does intend to actually be the point, then we're already past the 9th of April. And so, in fact, we might have already passed the peak once the revised data all comes in. And we can see that already we're at a point where the graph should start to curve down and the rate of increase should become less in the weeks ahead. Now, another interpretation is that, in fact, the logistic curve for 30,000 is wrong, and that actually the data will turn out to lie on that dotted line of best fit that I've drawn there. Because, in fact, there may be some other things going on that make the modelling more complicated. Because the logistic curve assumes that there's just one steady dampening factor which brings down the exponential growth over time. But actually, of course, there may be factors that have slowed the growth down rather quicker, that have flattened the curve. And of course, all the things that have been put in place, if rather belatedly in England and the UK more generally, will have had that effect. So perhaps the lockdown is taking effect, and therefore the rate of growth is slowing down more markedly than might otherwise have been expected. Now, the useful thing is we don't just have to rely on modelling, because we can draw on data from other countries that have been ahead of us on the curve. For example, Italy. And here is the data that has been plotted from the statistics from Italy, which hopefully are more accurate than those from the UK. But as you can see, there's over 6 weeks of them there, and therefore they form a fairly consistent curve over time. Again, if you draw a logistic curve for that graph, it appears to be going off too steeply. The actual line of best fit, rather than like that for the NHS England data, is a shallower curve. So perhaps we can be confident that things aren't going to develop quite as badly and as quickly as perhaps that logistic curve suggests. Now, the daily death tolls from Italy actually peaked at their maximum increase on the 27th of March, marked on the curve here. But again, just a reminder that reaching the peak certainly doesn't mean that that's the end of things. You're only part way through an increase in deaths that will continue for some time afterwards. But at least hopefully on this graph a peak will be reached soon in England as it has been in Italy. But what factors might have led to that slowing down of the growth compared to a logistic curve? Well, of course, in Italy there was a national lockdown implemented on the 10th of March, and that might well link with that reduced gradient of that graph. But interestingly, I've had to try to model this curve. I found that in the end I had to use 3 different parts of a curve in order to model it. The exponential part at the beginning, an additional flattened curve perhaps representing a lockdown. But interestingly, towards the end of that time period, I actually had to factor in something which showed perhaps a countervailing factor, something that was tending to increase the rate of deaths. And of course, that could be the kind of factor that happens if a health service is overwhelmed by the amount of work it has to do and hasn't got the equipment to match that. And of course, that was a problem in Italy. It'll be even more so a problem in England and the UK, and indeed is already. So while we can try and use maths to unpick the issues here, the reality is that the only thing that perhaps we can be really sure of is at the end of all of this, there will be an even greater lack of trust from many people in government and in its statistics. Because it will become clear that the official daily announcements have substantially underestimated the real numbers. Optimistically, we can hope that the revised data will continue to track the generally slowing rate of growth in Italy, although even then, that will end up with substantial death tolls that could and should have been lower if the proper action had been taken. We could, of course, have a situation where the updated data that starts to come in from care homes and other sources starts to substantially affect the overall totals as well. And therefore, we could yet see a sharp rise continuing with revised data overtaking and exceeding the already heavy death toll in Italy, which, of course, is what some people are already predicting. Let's see what happens in the days and weeks ahead. But again, let's not forget what has been done and what should have been done and what we will now need to do to make sure that we have in place parties that will actually fight for workers' rights and for health and safety, and to make sure that we have a better world, not one that copes with the crisis as badly as this.